Good evening, Bahamas. You're tuned into MB12 Weekend, broadcasting from Cable 12 Studios on Robinson Road. Coming up tonight, the BIA still offering an alternative to the current NHI model. A women's rights activist says there's no political will for a gender referendum. A new Boxing Day Junkanoo start time and new rules expected to make the parade run more smoothly. Plus, as always, we count down the top quotes in news this week. I'm Paige McCartney. We've got those stories and more straight ahead on MB12 Weekend. Welcome once again to MB12. While government has been slow to provide details on the National Health Insurance Scheme it intends to implement in just over 2 weeks, stakeholders in the healthcare and insurance industries say the water is still murky as to how the new regime will work. Chairman of the Bahamas Insurance Association, Emmanuel Komalafe, has been vocal about the many unanswered questions he believes need to be answered before the green light is given. But he says one of the important parts in this debate that needs to be realized is that there's no one-cap-fits-all approach to universal health care.
A model has been proposed by the government, which effectively, from our perspective, reduces significantly the role of the private health insurers and brokers and agents. And so we're saying if you can achieve the same objective without destabilizing an industry and displacing persons from their existing jobs. Because, the reality is based on what we see now, there will be impact on jobs. And, whereas it may be said that, it may be shift now from the private sector to the public sector, generally the trend globally has been, privatization and movement from the public sector to the private sector. Why would we want to reverse that? If our objective can still be met by putting regulations in place, legislation and enforcement, why do we need to destabilize the existing industry?
Komalafe said with the insurance industry contributing to at least 9% of the nation's gross domestic product annually, the destabilization of the sector would mean more than just a few hundred jobs. That's why the BIA is suggesting an overall health insurance industry reform instead.
But when we talk about families and individual lives that will be impacted, you talk about thousands. Because the average family perhaps has 4 persons. So you can see the multiplier effect. And so what we're saying is let's preserve, what works right now. If we have to regulate, what our proposal actually calls for health insurance reform. I mean, it's quite interesting that actually the industry itself is calling for a reform. But why are we doing that? We're doing that because we know that with universal health coverage, change has to come. We don't oppose change. What we're saying is let's do this in a way that is, one, affordable, sustainable, but least disruptive to the existing infrastructure, not just to the industry, but also to the economy.
The BIA's alternative plan follows a mandate that would offer the same services to the same demographics NHI proposes, but through a privately managed system. It also calls for health care cost regulation.
In this whole debate, we talk about health insurance premiums, but we forget what drives up the cost of health insurance. Healthcare costs globally continue to rise. Why is this? You have medical inflation, but also in addition to that, in the past, you have a lot of invasive procedures, surgeries, but now you have cases where doctors and medical practitioners can use tubes. With technology, you have even more medicines, more pills that allow people to live longer, but they come at a cost. So the cost of healthcare continues to go up. But remember now, when you get health insurance premiums, they're being used to do what? To pay the healthcare costs, and persons go to the doctor for a procedure. So there's a strong correlation between health insurance premiums and the cost of healthcare.
The first phase of NHI involves registration of nearly 350,000 eligible recipients between January and April 2016. The primary care package is expected to begin in earnest in April. Komalafe said the BIA is in full support of universal health care so long as proper consultation is conducted.
Everyone is in support of universal health care. I mean, sometimes when we listen to the debate, you'll think that they're actually opponents of this progressive social initiative, but there aren't any. All people have been asking for, the Medical Association, the Chamber, the Bahamas Insurance Association, is meaningful consultation to ensure that whatever we do is the best product that we can design for the Bahamas.
Ultimately, it boils down to sacrifices by all stakeholders, according to Komalafe, but he said those sacrifices can't be agreed upon without meeting around the table. Well, with 2015 quickly coming to a close and still no constitutional referendum, one gender rights activist is accusing the government of lacking the political will to finally pull it off. Outspoken activist Marian Bathel insists politicizing the referendum has done nothing but hinder the process. Jasmine Brown has her candid comments in this report.
Bathel insists the time is now to hold a constitutional referendum, but she says that's not happening because of a lack of political will, among other things. Bathel says the way she sees it, there are a number of reasons why there has yet to be a referendum, including what she called political cowardice.
I don't think there's a political will to actually have this referendum. I think the political will ranges from political indifference, meaning that politicians and parliamentarians and the government sometimes are indifferent to this particular principle of equality, gender equality, and non-discrimination on the basis of sex. And then you also have what I would call political ambivalence, meaning that politicians are really looking at the political climate to see whether this particular referendum can actually be won. And if it can't be won in their estimation, it keeps being postponed. And so I'm really looking for a political boldness on the part of our parliamentarians and our leadership, our political directorate, the government, to actually exercise leadership.
Bathel did not solely put the blame on the politicians. She also shared it with the electorate.
The electorate, as we know, is prone to partisan politics. And so it requires the kind of leadership that unifies partisan politics. In other words, the principles of gender equality, principles of equality and non-discrimination are universal human rights principles. Any leader in this country ought to be looking at that as a unifying element for this country.
The referendum has suffered several delays over the past 2 years. Prime Minister Perry Christie had initially set the constitutional referendum for June 2013. But later changed the date to November 2013. He later said the constitutional bills would be brought to Parliament before the end of 2013 and passed in February 2014. Late last year, the referendum was postponed again until 2015 from November 6, 2014. But with this year quickly coming to an end, there has been no word on a new date. Bathel says the fact that the Bahamas is lagging behind on the issue is embarrassing.
We do not have the rights and privileges under the Constitution that men have as citizens. And so this is blatantly unfair.
She adds that the time is now to give women equal rights.
In the Bahamas, we have fought for racial equality in the 40s, 50s, and 60s, and we won. It is now time for gender equality. There is absolutely no difference between the fight for racial equality and gender equality between women and men under our Constitution.
Reporting for NB12, I'm Jasmine Brown.
Well, last year, Prime Minister Perry Christie was among the thousands of Junkanoo patrons who complained about the disorganization and lengthiness of the biannual parades. Well, the Ministry of Culture and Junkanoo Corporation officials are seeking to correct those issues by implementing a number of changes that are expected to make things run more smoothly. Parade Management Chair Jeff Lloyd said there should not be any complaints about Junkanoo presentation once these changes are made.
Not in terms of the music or the costumes, but rather what unfortunately had become a rather misfortune in how the parade extended itself throughout the entertaining hours. That will be corrected this year. It will be a seamless presentation of the acts by the various groups, such that the 30 and 45 and 60-minute gaps will be eliminated. Amen. And those rules will be strictly for the benefit of our public as well as the participants of Junkanoo. Those rules will be strictly enforced.
Another major change is that the Boxing Day Junkanoo Parade will start at 10 p.m. sharp on Christmas Day.
And I'm somewhat disappointed that there is still a misunderstanding about the start time for the, quote, Boxing Day Parade, even though it does not begin on Boxing Day. It starts punctually at 10 o'clock on Christmas night. That is 10 p.m. December 25th, 2015, and it will start 10 o'clock.
And to cut down on time and distractions during the parade even further, major costumes will be judged ahead of the big event.
The decision has been taken that there will be a pre-judging of the lead pieces of Junkanoo on Christmas Day, that is the 25th of December, 2015, at 3 p.m. in the Central Theater Square, which is downtown Nassau. 3 o'clock. It will extend from George Street all the way to East Street. Those pieces will be lined up in the street for an opportunity to be judged by our certified judging team. There is still yet to be decided as to precisely when the prejudging shall occur for the New Year's Day parade, but the press will be duly informed, and so obviously so will the public.
As a result of these changes, officials are advising a road closure on Bay Street starting from George Street to East Street beginning at noon on Christmas Day.